Hello and welcome to Medit Online. With Diwali around the corner, it's important to know the types of injuries firecrackers can cause and how to manage them. In this video, I'll guide you through identifying and treating different types of injuries commonly caused by firecrackers. I'll cover everything from burns to eye injuries and hand trauma, plus when to seek urgent care. So let's get started. Firecrackers can cause several types of injuries, including burn injuries, which are the most common ones and typically affect the hands, face, and feet. Sparks or accidental explosions can cause eye injuries, leading to irritation, redness, or even vision impairment. Hand and finger injuries often result from holding firecrackers, leading to cuts, lacerations, fractures, or even the loss of fingers. The loud explosions can impact hearing, causing conditions like hearing loss or tinnitus, that is, ringing in the ears. Burn injuries are the most frequent during Diwali, and knowing the burn severity is essential for proper treatment. First-degree burns are superficial, with symptoms of redness, slight swelling, and pain. These are commonly caused by minor firecracker sparks, and they affect only the outer layer of the skin or epidermis. Second-degree burns go deeper. They often cause blisters, intense redness, and more significant pain. They may be caused by prolonged exposure to sparks or a nearby firecracker explosion. Third-degree burns affect all the skin layers, potentially damaging nerves. So these are often painless at the center, but the surrounding areas may be painful. The skin may appear white, charred, or leathery. These usually result from direct contact with flames or explosions. Fourth-degree burns are the most severe ones and extend through the skin to affect muscles, tendons, and even bones. They typically appear charred and may be painless due to nerve damage. Although rare, such burns could result from intense or prolonged firecracker explosions close to the body. For each degree of burn, the first aid approach is different. So let's discuss what to do for each type. In case of first degree burns, rinse the area under cool running water for 10 to 15 minutes to draw heat away and reduce pain. If this is unavailable, immerse the area in cool water or use a cold compress or cloth soaked in cool water. Do not apply ice or very cold water, as this can worsen the tissue damage. Aloe vera gel can be applied as it has cooling effect. It is anti-inflammatory and keeps the burn area moisturized. So it helps in reducing redness and discomfort. Alternatively, over-the-counter burn-specific creams containing lidocaine or benzocaine like Bernol can be applied 2 to 3 times daily until the burn heals. Lightly cover the burn with a sterile, non-stick bandage to protect the area. Over-the-counter medications like ibuprofen or paracetamol can be used for pain relief. For first-degree burns, the goal is to reduce pain, keep the skin hydrated, and prevent further irritation. For second-degree burns, gently run cool water over the burn for 10 to 20 minutes. Alternatively, immerse the area in cool water or use a cold compress or cloth soaked in cool water. Remember not to apply ice or very cold water. If blisters form, do not pop them, as they protect the underlying skin. Bursting the blisters increases the risk of infections. apply 1% silver sulfadiazine cream. Please note that silver sulfadiazine should not be used on superficial burns or on the face due to potential discoloration. It is best reserved for second and third degree burns and should be used under medical advice. Use a clean, sterile, non-stick bandage to cover the burn. The dressing should not be very tight. Ibuprofen or paracetamol can be taken for pain relief and keep the area elevated to reduce swelling. Remember to seek medical help promptly if the burn is larger than 3 inches or affects joints or is located on the face or genitals. In addition to these conditions, medical advice should also be taken if healing does not progress within a few days or if there are signs of infection like increased redness and swelling, pus, or worsening pain. For second degree burns, the goal is to reduce pain, prevent fluid loss, and to prevent infection. Now let's discuss what to do for third degree burns. Do not apply water to third degree burns. Applying water can lead to more severe injury and increases the risk of hypothermia. Do not try to remove any clothing stuck to the skin. Cover the burn with a sterile, dry dressing. This helps to protect the area from contamination and minimizes exposure to the environment. Do not apply any ointment or cream or gel on your own before a medical evaluation of the injury, as these can trap heat, exacerbating the burn injury and can increase the risk of infection. Watch for signs of shock, such as rapid breathing, pale or clammy skin, weakness, confusion, or change in consciousness. Monitoring these vital signs is crucial to identify shock early and ensure timely medical intervention. Take the patient to the hospital immediately. Regardless of the size, third degree burns require professional evaluation. Medical professionals will assess the extent of the injury and determine the best course of action, which may include surgical intervention or specialized wound care. In third degree burns, the initial aim is to stabilize the patient until professional help is available. Now we come to fourth degree burns. Fourth degree burns are severe and could be life threatening. These require immediate expert intervention and careful monitoring in a healthcare facility. So in such cases, avoid applying water, ice, or any cream or ointment. Just cover the area with a sterile dressing or a clean cloth if sterile dressing is not available. Watch for signs of shock and seek immediate medical help. Now, if your clothing catches fire, stop moving, drop to the ground, and roll back and forth to extinguish the flames. Alternatively, if you have a heavy blanket or jacket nearby, you can use it to smother the flames. Just make sure to cover the flames completely and gently pat down to put out the fire. Once the flames are out, it's important to take care of any burns as explained earlier. Now let's look at the first aid steps to manage eye injuries from firecrackers. If any debris, chemicals, or sparks get into the eye, rinse with sterile saline or clean water for at least 15 minutes. Tilt the head so that water flows from the inner corner of the eye to the outer corner to flush out irritants effectively. After rinsing, place a sterile gauze pad lightly over the eye to protect it from further damage. Avoid any pressure, just let the gauze rest gently. Refrain from rubbing or using any medication like eye drops or ointments on your own, as this could worsen the injury. Visit an eye specialist immediately if there's pain, redness, or changes in vision. Eye injuries can lead to permanent vision loss if not handled properly, so don't delay medical care. Let's move on to first aid steps in cases of hand and finger injuries from firecrackers. If there's any cut or laceration, gently press on the wound with a sterile gauze or clean cloth to stop the bleeding. If the bleeding is heavy, try to keep the hand raised to reduce blood flow. Once the bleeding is under control, rinse the area with saline solution to flush out any debris or dirt. For minor cuts or abrasions, after cleaning the wound, you can apply a thin layer of topical antiseptic like povidone iodine or a topical antibiotic like neosporin. But if the wound is deeper or if there's any injury with a risk of fracture, it's better to focus on stopping bleeding and immobilizing the area, as certain creams may not be recommended for complex injuries. If there's a possibility of a fracture or severe sprain, keep the injured hand or finger still. You can gently wrap or splint it with a clean, flat object like a popsicle stick or ice cream stick to stabilize it until you can get medical help. Place a sterile dressing over the wound to protect it from infection. The dressing should be snug but not too tight, as you don't want to restrict circulation. For severe cuts, swelling, or suspected fractures, seek medical attention promptly to prevent complications. These steps help to manage hand and finger injuries by controlling bleeding, reducing infection risk, and stabilizing the injury until professional medical care is available. Now let's talk about the key steps to follow in cases of ear injuries from firecrackers. First and foremost, avoid manipulation. This means don't insert any objects into the ear. This can worsen the injury and push the debris deeper. Use a warm cloth around the ear to help relieve pain and swelling. Just make sure it's warm, not hot. If you notice hearing loss, bleeding, or tinnitus that is ringing in the ears, get to an ENT specialist right away. These could be signs of serious damage. While these steps can help with immediate care, certain signs indicate the need for hospital intervention. Any third-degree burn, large second-degree burns, or burns on the face, hands, or genitals, persistent pain, blurry vision, or visible damage to the eye, major cuts or suspected fractures or loss of movement in the fingers, any sudden hearing loss or persistent ringing. Before we wrap up, here are some quick tips for a safer Diwali. Use protective glasses and avoid bending over firecrackers when lighting them. Keep water and a first aid kit handy. Supervise children all the times around firecrackers. So there you have it. If you or someone around you experiences any injury from firecrackers, follow these steps to ensure proper care. Stay safe and enjoy the festivities responsibly.